Good day, I'm Chanel Margaret Valde from BSN 2A, and today I'll be performing perineal care and straight catheterization. The purpose of performing perineal care is to maintain cleanliness and prevent infection in the perineal area, as well as to provide clients comfort. And the purpose of performing straight catheterization is to relieve urinary retention, to promote urinary drainage, or to empty the bladder of the client prior to a diagnostic procedure, surgery, or delivery, and to collect urine specimen for urinalysis or for other examinations. For the materials, we will be needing sterile gloves, catheter of appropriate size, 8 pieces of cotton balls with betadine solution, water-soluble lubricant, a urine specimen container, waterproof pad or Kelly pad, drape, pitcher with lukewarm water, pail, and water receptacle. To begin the procedure, we'll perform first the assessment. Review the need for perineal care. There are some instances in which our client can perform the procedure or the perineal care by themselves, and there are also some clients who are unable to do things or necessary activities for themselves. That's why we need to give them our assistance. And then check order for catheterization, check the patient's chart, and check the client's record or history to be sure that this procedure needs to be given to the client. And then next, assess the genital of your client, assess the surrounding skin and the perineum for intactness of the urinary orifice, if there's skin redness, excoriation, breakdown, drainages, or discharges, and for area of tenderness. And upon inspection, there is no redness, breakdown, or excoriation of the skin. The urinary orifice is intact, and there is no visible area of tenderness or swollen areas. And then also determine the perineal genital hygiene practices and self-care abilities that our client performs, such as the morning cares, as this affects the current condition of the client's perineum. And this information will serve as our baseline data that we can use to compare to the findings or observations that we will gain after performing the procedures. And then for the planning, gather all the necessary materials needed to save time and effort. And then identify your patient. Good morning, ma'am. I'm Chanel Valde, and I'll be your attending nurse for today. May I know your name, please? Alright. What would you like me to call you today, ma'am? Okay, Mrs. Reyes. You can identify your patient by asking her directly or by looking at the client's wristband. Today, ma'am, I'll perform perineal care to maintain the cleanliness and prevent infection in your perineal area, and this would also provide you a sense of comfort. And also, I'll be performing straight catheterization. This is the method that we use to empty your bladder, and it facilitates the presenting part of your fetus to descend in your pelvis, and will prepare you for the delivery of your newborn. Will that be alright? Explain the procedure to your client, why is it necessary, and how she can cooperate. And then perform hand hygiene. You can use an alcohol to prevent or to minimize the spread of infection or microorganisms. And to begin the procedure, ma'am, we'll begin the procedure now. So first, place the client in lithotomy position. Ma'am, I will place you in lithotomy position. In this position, the client is lying on back with the legs flexed 90 degrees at the hips. This position facilitates exposure of the perineal area. And then place Kelly pad under the client's buttocks. Placing a Kelly pad under the client's buttocks facilitates the drainage of all body secretions towards the pain on the floor. And then drape the client's abdomen and thigh to provide further privacy since we will be needing to expose the client's perineal area. Ma'am, I will cover your abdomen and your thigh so that you won't feel too much uncomfort throughout the procedure. After draping the client, ensure adequate lighting in the perineal area to facilitate proper viewing of the urinary orifice and the perineum. If available, you can use a drop light to facilitate proper viewing. And then wash your hands to prevent spread of infection, and it facilitates or prepares us for gloving. And then prepare sterile tray within reach, and it contains the sterile gloves. And as we open the sterile gloves, we will make a sterile field out of it, in which we will be placing the 8 pieces of cotton balls with betadine solution, the water-soluble lubricant, and the catheter. The preparation of materials is necessary to save time and effort, and also to minimize the chances of us needing extra help while performing the procedure. So first, open the sterile gloves and make a sterile field. Ensure sterile technique while opening the sterile gloves to prevent it from contamination. And then away from the sterile gloves, place the 8 pieces cotton balls with betadine solution. Betadine is used since this is an antiseptic and disinfectant agent, and it works by killing and preventing the growth of microorganisms in the vagina. And then put an ample amount of water-soluble lubricant in any vacant spot in the sterile field. Then open the catheter and place it also on the sterile field. Using a sterile technique. And then after the preparation of the materials, also test the temperature of the water before pouring small amount of it on over the perineum and inner thighs of the client to avoid client's comfort. And after checking and making sure that the temperature of the water is tolerable for the client, pour small amount of it over the perineum and client's inner thighs. This provides client's comfort. And then after that, put on the sterile gloves. Sterile procedure requires the use of sterile materials and techniques. Putting on the sterile gloves, we'll begin cleaning the perineal area of the client using our dominant hand. So this procedure is part of the skin preparation for the delivery of the newborn. So first, clean the mons pubis and the left and right inner thighs of the client by using cotton balls with betadine solution in a single zigzag stroke from proximal to distal perineum. So clean from vagina outwards so that microorganisms will move away and not towards it. And then remember to use different cotton balls in cleaning the different sides. And then next, clean the labia majora, again by using cotton balls with betadine solution with a figure of 7 on the left side in a single stroke and the reverse figure of 7 on the right side. And then next, also clean the labia minora by spreading them out using your non-dominant hand and use the same manner for cleansing as the labia majora. So a reverse figure of 7 on the left side. A figure of 7 on the left side and a reverse figure of 7 on the right side. Secretions that tend to collect in this area facilitates the growth of microorganisms. That's why it is important to clean that area. And then lastly, apply a last single downward stroke from the urinary orifice to the anus to prevent complication in the vaginal inlet. After performing the perineal care, we'll proceed in performing straight catheterization. So first, pick the catheter using your dominant hand and then apply an ample amount of water-soluble lubricant at the insertion tip of the catheter, about 5 to 7 centimeters or 2 to 3 inches. Using a sterile aseptic technique, lubricants facilitates the insertion of catheter. and then place the drainage end of the catheter towards the Kelly pad or towards the urine receptacle using your non-dominant hand to fully drain the urine. And then gently insert the catheter into the urinary meatus. But if there is resistance, do not force the catheter. Ma'am, please take a deep breath. Ask the client to take a deep breath and advance the catheter when the client exhales because the muscles are relaxed during exhalation. And then allow the urine to flow and collect urine specimen for urinalysis and for other examinations. In a midstream collection, we're going to allow some urine to flow first because as it rinses the passageway for any microorganisms that may be present. And then after that, allow the urine or the 20 to 30 ml of urine to flow into the urine specimen container without touching the catheter or the rim of the bottle to prevent complications or contaminations rather. And then after obtaining the enough amount of urine for urinalysis to be sent to the laboratory, fully empty the bladder and wait until the urine stops. And when the urine stops, remove the catheter by pinching and removing it smoothly. And then you can now remove your gloves. And then dispose the used materials in the waste receptacle. And then after performing the perineal care and straight catheterization, proceed to the evaluation phase. So perform reassessment of the genital, the surrounding skin, and the perineum for intactness of the urinary orifice. Again, for skin redness, breakdowns, excoriation, discharges or drainages, and area of tenderness. So through inspection, there is no skin redness, breakdowns, or excoriation, as well as abnormal discharges. There is no visible swollen areas, and the urinary orifice is intact, and that is considered as a normal finding. And if there is any note for abnormalities that was observed. And then also note for any untoward patient's response. Ma'am, now we're done with the procedure. Do you feel any discomfort? Okay, it's good to know that you felt comfortable throughout the procedure. And for the documentation, record the procedure and any client's untoward response. Also, we need to record to the client's record the assessment before and after the procedure for us to compare the condition of the client before the procedure to the findings that we have gained after performing the perineal care and catheterization. Also, we need to record the type and size of catheter that we have used. So we have used a straight catheter French 12. And also, record the type and amount of urine that we have obtained. So we have obtained a pale yellow to dark amber color of urine, and also it is transparent, and that is also normal. And then also check and record whether the specimen was sent to the laboratory for examination or urinalysis. Remember to record all the procedures that we have done, including the steps and rationale, because everything that is not properly documented is considered as not done. And that's the end of the demonstration. Thank you and God bless.